Good evening, St. Lucia. Welcome to Healthwise, a production of the St. Lucia Medical and Dental Association in collaboration with HTS Radio 100. I am your presenter, Dr. Merle Clarke, thanking you as always for joining us. I'd invite you to stay with us for the next hour or so as we continue to discuss COVID-19, St. Lucia's response, our response as a medical community. This year, of course, I saw yesterday on social media, and it was posted by one of our beloved nurses, Sister Lydia Leos. And if you could just put it up on screen for me, Grimes, because this year, of course, has been designated by the WHO the year of the nurse and the midwife. And our plan, of course, had always been, let's celebrate our nurses and our midwives, because without them, we cannot do what we do. And it goes like this, as you see on screen. So many nurses around the world are losing the battle to COVID-19. 2020, the year of the nurse and the midwife. Extremely sad indeed. And it is. I mean, the reality is that when you look overseas, what has happened, and the situation seems to somewhat be calming down a little bit, but many healthcare providers, many frontliners have lost their lives to COVID-19, and we are not unaware of that in this part of the world. And for today's episode, because 2 weeks ago we allowed our physicians in the diaspora to speak, this week we are going to allow our frontliners here to speak, our police officers, fire officers, doctors, nurses, the assistants. Just let everybody speak so you understand what the COVID experience has been here. And I think the ministry has done very well in terms of us containing of sorts COVID-19 in St. Lucia, but there is a lot of hard work happening on the ground, despite the fact that we don't have this explosion of numbers as has been seen in certain places. But nurses, midwives, we appreciate you, we love you, and we continue. COVID will pass. At some point it will. It may take a lot longer than some of us imagine, but we will continue to celebrate you. You with us, we are the frontliners, and we do appreciate that. In keeping with that, yesterday, St. Lucia joined the rest of the world in observing World Day for Safety and Health at Work. Now, generally, it's somewhat more low-key than what it was yesterday, because it happened and then that was it. But health and safety at work is extremely important. It always has been, and perhaps even more so now than ever with COVID-19, with the extra precautions that do have to be taken. And again, in keeping with the fact that this year had been designated to recognize and celebrate our nightingales, our nurses and midwives, the focus again was on them. Because what has been recognized with the advent of COVID-19, with what is going on with physicians, with nurses, and everybody essentially in the front line, that what you have is people who are working longer than normal hours, the psychological distress, fatigue, the occupational burnout, stigma, unfortunately, against our nurses. It's almost like you can't even wear a scrub top nowadays, or somebody's going to look at you very strangely. And again, as we'd said before, and we'll have them on here to talk about it, should you be wearing your scrubs and nursing uniform outside anyway? And quite a few people would argue that you really should not be. But we cannot be stigmatizing our nurses and midwives as it is. They really are here to help and to protect, and we do need them all. So again, health and safety in the workplace, you have to insist, not just hospitals. With the advent of COVID, everything really has changed. So, I mean, you see it happening, the hand sanitizer when you enter a store, the changes that are made at the stores, so the contact with cashiers isn't as it used to be. Every workplace certainly has to take measures as we look to start slowly doing some things, because at some point we do have to reopen. It certainly has to be slow, and the exit strategy, which is what you hear a lot of talk about, what exactly is it going to be? And Dr. Amanda King on the weekend had a widely circulated paper about the 6-week strategy to get over COVID, in a sense. And there are different strategies being employed in the world. New Zealand, one of the countries which has done very, very well, they are reopening, and then you see places like Singapore, Japan, which had done very well initially, you're seeing something of an increase in cases now. So the exit strategy as it pertains to COVID is extremely important, and it is important that we get it right. Again, no one strategy works. It's a question of getting all the brilliant minds together and knowing how we do this and do it carefully so we don't get a huge explosion of cases. But in workplaces, I mean, for the foreseeable future, COVID is going to be with us. So we do have to learn to live with it. Again, it's a question of flattening the curve, keeping that curve flat so our healthcare system does not become overwhelmed. So the 6 feet distancing, that is going to continue to obtain, I think, for the foreseeable future. The ubiquitous Zoom meetings or online meetings, those probably are going to be with us for a while. The washing of your hands longer than what you're used to. The wearing of masks in public, and so many different things that we've started doing now. The use of hand sanitizer more often, that we probably are going to have to continue doing if we are going to fight this virus, which, as has been said, it is making the timeline. It's making the timeline this invisible enemy that we are fighting. So it is important that the workplaces be kept safe. Employers, you have an obligation to your employees to ensure that they are taken care of in that regard, and then that the risks really are minimal, because we are understanding now how important our workers are if we did not understand that before, and that we need them, and we need them to be well and to be appreciated. So many stories, and I mean, for some people it's funny, for some people it's not so funny because it's so real, but this COVID is showing us our dependence on alcohol of sorts, and it's a conversation that needs to be had, because it's not a question of alcoholism necessarily, but probably the most common cry is to reopen the sale, make the sale of alcohol possible. So it shows you how much we drink in St. Lucia, and there have been studies in the past, so we knew it. We knew that St. Lucians drank a lot of alcohol as it is, but this is really coming to the fore now with the request to make that available to the general public. But while that is still not available, and as I've said before, I mean, my vice is coffee. I like coffee, all different forms. Lattes coffee, that's my thing. Birthday present coffee, and I'm the happiest girl in the world. So if coffee weren't available, I probably would be sad as well, but you know what? I would learn to move on. These are not normal times. We're dealing with something unprecedented, and I think there are sacrifices that have to be made, and alcohol, unfortunately, is one of them. So eventually the sale will be available, but for now the answer is no from the Prime Minister. So St. Lucians, we have to keep Weglo. That's my excuse when people ask about alcohol. Drink more water. That should suffice, I think. Not many people are going to like that, but it is what it is. You hear stories, of course, of people consuming hand sanitizer. Again, anecdotes, I have never seen it happen. I hope it is not happening. St. Lucians, rubbing alcohol, hand sanitizer, no. It's a no-no. Methanol, for example, because the alcohol that is typically consumed contains, the alcohol is called ethanol. The one in rubbing alcohol and that sort is called methanol, and it can cause blindness. So St. Lucians, we are urging you, do not drink or consume your hand sanitizer just for that fix. Do not, besides you needed to wash your hand, and alcohol and disinfectant cannot kill corona inside your body. So just for the record, that as an SLMDA, we are discouraging that completely. So it's not going to do it, but please do not consume, because it's compounding an already bad situation. You potentially can go blind if you consume methanol. So Professor. In St. Lucia, again, the Chief Medical Officer earlier today announced that there are 2 positive cases, patients who had been isolated since the 4th of the month of April at the Rodney Bay facility. They had been quarantined, of sorts, if we look at the definition, because they were for the most part asymptomatic. But whereas we were speaking up to yesterday of recovery of all our 15 patients, now we have 2 more positive cases, and we will speak to that. And again, she had insisted, let us not let our guard down. We have to act as if everybody has COVID and continue the hygiene practices and wearing a mask and all of that. But there still seems to be quite a bit of confusion as it pertains to isolation and quarantine. And we've spoken about it here before quite a few times. Just look at that slide. I think you've seen that slide a few times. Maybe we need to get one with fewer words, but there are fundamental differences between isolation and quarantine. The action of sorts is the same, in that you have that person away from the general population of sorts. But somebody in quarantine is somebody who is well, somebody who doesn't have symptoms. That person may have been exposed, be it to coronavirus or any other virus, H1N1, any infectious disease. You can quarantine that person to prevent them, in a sense, from getting sick. And if you look at there, it's for well people who may have been exposed to a communicable disease. It applies to people who may or may not become sick. So a person in quarantine may spend their whole quarantine period. In the case of COVID-19, we're looking at a 14-day incubation period. So those 14 days may pass and that person may never become sick. Of course, it does become complicated when you have cases of patients who never had symptoms and they of course test positive. So that is for a whole different story, and we'll talk about that. But generally the quarantined person may very well not present with symptoms at all. So quarantine restricts movement of the person, of the healthy person who may develop the disease after possible exposure to an infectious agent. And it requires people to stay in a designated location, which can be your home. You can be quarantined at home for a specific period of time. Isolation, however, isolation is normally for sick people. So somebody who has symptoms can be isolated. So in the case of St. Lucia, patients generally are isolated at Victoria Hospital, which is the respiratory hospital. There are a few cases perhaps at the other centers, the Rodney Bay Center, but for the most part, the patients who are symptomatic are isolated at the Victoria Hospital. So the confusion with the numbers, how come everybody had gone home who tested positive, but we still had a certain number of isolated patients, is because there are patients who are in isolation who are still waiting for results. And that's important. So if your results are still pending, you are still in the hospital, and it does not mean that you have COVID-19. So we felt the need to absolutely clarify that. And as I said, this evening, you'll be hearing from our frontliners, and they will again make an attempt to clarify that. St. Lucians, we are asking for some understanding right now with COVID-19. Because the reality is, and I think everybody by now would have heard of or read of that case in Jamaica where a young lady, a young pregnant lady, 23 years old, her birthday would have been yesterday or today, who was apparently, as per the articles you read, denied care at different institutions because of suspicion of COVID. And there are times it gets complicated because whereas in the pre-COVID era, if somebody had heart failure, for example, how does heart failure normally present when the person is what we call decompensated? Shortness of breath, I cannot sleep, I have to sleep with my head raised high, sometimes my leg may be swelling, and that sort of thing. A pneumonia may also present with a bacterial pneumonia, for example, shortness of breath, in that case probably fever. I walk a short distance and I feel short of breath. COPD, which we've heard so much about. Even our dialysis patients, for example, sometimes coming off the weekend, they have shortness of breath. But the reality is we are living in a COVID world now. So shortness of breath currently means you are going to be tested. If you are tested, that means if the swab is done, and our physicians again will explain to you how that swab is done. If you are tested, you go to one of the respiratory clinics and you are tested, you are probably going, especially if you have symptoms, probably going to be isolated. And we need your assistance and your cooperation with that. It is for the protection of your family and for the protection of the country as a whole, because you hear cases of patients trying to escape and insisting they don't want to stay there or that they don't want the swab done. It cannot be that way. This is a public health issue, and that is why the public health measures do have to come into play. So we do have, I think, currently close to 40 patients isolated at Victoria Hospital, in as much as there would be among them, there would be only 2 positive patients who were the patients announced this morning by the chief medical officer. And questions arose again because those patients had been in quarantine or isolated since the 4th of April, and of course the questions abound. So today is the 28th or the 29th of April, so we're 25 days in. How come it's only now being reported? I don't know the specifics of the cases. I haven't spoken to anybody, but that could be explained. So as we said, somebody's quarantined. So if you were a contact, and she did say those were contacts of patients who were previously positive. If you were a contact of somebody but you're not manifesting symptoms, you very well may not be tested because our testing hasn't opened up so much to allow for that. Remember, there's still limited resources, and this is a global situation, not just a St. Lucia situation. So that person might have been quarantined, and that's exactly what happened. So in the contact tracing process, and we are hoping to have our epidemiologist on very soon to explain to us how contact tracing happens, those people would have been picked up and they would have been quarantined. It could be that perhaps at day 10, because we're looking at an incubation period of 2 to 14 days, on average 5, but it can be as much as 14. Towards the end of the period is when they were tested, because they might have become symptomatic, and that's when they were tested. And then the test, there was a delay in the results. I don't know, but these are possible scenarios as to why those patients would have been there since the 4th of the month, and of course only hearing of their results today. Now another question is, of course, at the beginning of all of this there was a lot of talk that you can be quarantined at your home if the conditions are available, and yes, that could happen. But for now we don't have any major outbreak, so the isolation is happening at the hospital. So a patient who is highly suspect of having COVID-19 does go to the Victoria Hospital, and again our chief medical officer would have explained the why as a public health policy that happens, but perhaps we do need to explain again because there have been quite a few complaints. We know it is what it is. VH is not the prettiest place in the world. The conditions aren't necessarily optimal, far from it, but it is where we are isolating patients, and there are things that have to change. There are differences in terms of that. There's ongoing work as well to ensure that in as much as possible each person has their own bathroom and so many different things. And in terms of the patients who've recovered, we will get them to speak of their experiences in short time, and they may be able to tell you about some of that. But St. Lucia, we are fighting a battle. It is not ideal, but we can do it. We can get there. So I do hope that clarifies a little bit about isolation and quarantine and the confusion it can cause. So you may have many more patients isolated because they are ill. Some of them will come out to be negative because, as the CMO said, 42 of the tests done were negative. 2 of them were positive in the last batch. So quite a few of the isolated patients would have had negative tests. So those patients, and how is it happening in St. Lucia right now? So what we are trying to ensure is that we do not get patients with COVID at OKU. So the threshold for transfer of a patient to VH is quite low. Now the patients who are just suspicious, the patient who very well may have heart failure or an asthma attack or COPD, is not put in the same place with the patient who is known to be positive for COVID. But you are, remember, VH has multiple buildings, but you are transferred to there, you're tested, and we await the results. Once those results are negative, if that patient still needs VH, also has all the medication, the physicians are there to treat the other conditions, because what we are is that we split between the 2 hospitals, and of course with the assistance of the Cuban physicians and nurses. So if it turns out that that test is negative, that patient would have been treated for their heart failure anyway. So if their COVID test is negative, they very well can be discharged from VH if they are better. If the patient, however, is not better and the test comes back negative, they very well may be transferred to back to OKU, which is where we're treating everything non-COVID for the most part. So those little things perhaps we have to do better in terms of explaining them, but that is why sometimes you will hear the patient was transferred from OKU to Starfish to VH, and then from VH back to OKU. It is happening. It is our reality, but as we've said before, COVID has changed many things. In the past, everybody came, you went to the same emergency room. That is not what is happening anymore. You're speaking of tents, you're speaking of separation of patients with shortness of breath or other respiratory symptoms, and not going to the same place with patients who do not have those, and that is the reality. And those are all efforts to protect you, the general public. So people coming into the emergency room with, the constraints of space and the like, do not infect. One doesn't infect the other person. So it can be a bit frustrating, but we are asking that you bear with us, particularly in the public healthcare system, so that we need to get it right. We need to get it right for all of us. Hey, Christmas is coming. We have to start talking about Christmas because everything else is gone already. So we need to at least be able to have Christmas. And if we don't get it right, we're not even going to be able to do that. So it is frustrating as it is. We all have to try to do this together. So our COVID dashboard, the ministry, so the dashboard is updated daily. So you see what is going on as it pertains to COVID, and there you see it at a glance where we are at currently. So the number at the top would be, as per the World Health Organization, the number of positive COVID cases worldwide. So in St. Lucia, 17 is our number. Of course, 2 were repatriated. The others have recovered. The 2 recently admitted today, as announced by the Chief Medical Officer. So number of patients here in isolation in St. Lucia, 57. So you see the number of patients in isolation is way higher than the number of patients with COVID, because as I said, only 2 of that 17 would be in hospital currently. But look at the 57 patients that we have in isolation. Quite a few of those patients will likely turn out to be negative, but we simply cannot take the chance, because one patient could infect so many others, and the growth is so exponential, so quickly it could explode, that we just cannot take the chance right now. So we are isolated. The threshold for isolation is quite low. So 490 tests done so far. Let me see what else we have there. Number of persons quarantined in St. Lucia, and that could be at the Rodney Bay Center or at the at home, the different places where patients are being quarantined. So that number there, that is your dashboard, and it is available on the COVID website. So it is updated multiple times a day, the press releases and everything you need to know about COVID. St. Lucia, we need to get the information. It is out there. Protect yourselves. We're still asking people to stay home. If you can work from home, continue to do that. We are not out of the woods. Even when it was announced that all our patients had recovered, in as much as it's a wonderful milestone, it certainly is not a call to let down our guard or to think all is fine. When you hear that traffic was backed up going to Grosley yesterday, Pugisa, for what? There's absolutely no need or no reason that traffic should be backed up, St. Lucia. It is not business as usual. There are things that we would need to do. I needed to change my brakes. As I said, Dr. Ferdinand needed to change her tire. So there are things that will happen because we do need to get to work. But it cannot be business as usual. It won't be business as usual for quite a while, St. Lucia. So we still continue to urge you, as the Chief Medical Officer will tell you, because we'll allow later after the break, you to hear what she had to say in case you have not heard it for the day. Stay home, wash your hands, wear a mask if you're going out, go out only if you need to see your doctor, to the pharmacy to get groceries, cover your cough. If you feel unwell, call one of the centers. The numbers are widely available. Psychological help is important. I think we did miss that slide. The tips, the Bureau of Health Education, they've been doing a wonderful job in terms of getting the information out. And I mean, I was speaking to one of the patients who recovered today, and she did make the point that psychological assistance and support should not be if the patient asks for it. It should be mandatory, and that is something the ministry can look at. Of course, Dr. Belma always open to suggestions. They are always open, and we could recommend that every single person gets the psychological support that they need. But if, St. Lucia, you are feeling overwhelmed and you are feeling you can't, there is support. So there are psychological support lines but talk to people, your family for the most part, because obviously you're not going out to the beach or anywhere and you don't have any alcohol, but you can't be using alcohol and cigarettes and that sort of thing to cope, because that weakens your immune system, and you do need a robust immune system to be able to fight COVID if, God forbid, you were to get it. So it is important. So if you feel overwhelmed, talk to a health worker or counselor, have a plan where to go and how to seek help for physical and mental health needed if required. Don't use smoking or alcohol or other drugs to deal with your emotions. So very, very important tips there, St. Lucia. So the Bureau of Health Education, you could follow them on their Facebook page, Bureau of Health Education, Ministry of Health. The information is there for all of us. It's available on social media, on conventional media. It really is everywhere, the information. The SLMDA's Facebook page, our website. St. Lucia, there really is no need to not have the necessary information. If there are questions, you can ask us. Everybody's willing to answer the questions because we understand that it can get confusing. So all the talk of testing and the rapid testing, what's the role for that? And the antibody test, which is the rapid test. So many things that we know could be very confusing for you, St. Lucia. We encourage you to ask the questions. That's what we're here for. We like to talk. We will answer them. So in this evening, celebrating excellence, we celebrate one of our frontliners. So she is one of the first physicians who was at the respiratory hospital, when of course, I mean, not very many people want to go there because, again, the idea that so many colleagues overseas have died and have become sick, it's a hard decision to make. And yes, we took an oath, but it's not easy. The psychological impact, thinking of your family. But our Dr. Joyanne Chico took up the challenge very early, along with our Dr. Janoma Giffard, our junior doctor rep par excellence. They took that up very, very early and have been there and doing a fantastic job. So Dr. Joyanne Chico, she's a proud Laborian, so yes, from the People's Republic of Labrie, and by extension, St. Lucian. She grew up in the beautiful, amazing, picturesque fishing village of Labrie, where togetherness is beyond exceptional. St. Lucia Tourism Authority, I hope you are too. Togetherness is beyond exceptional. She started her educational journey at the Labrie RC Girls Primary School, then the Viewfort Comprehensive Secondary School, and subsequently A-Level. She pursued a medical degree in the Republic of Cuba for a course of 7 years. What a great experience it had been. What a great experience it had been getting to know a different language, or it was, getting to know a different language while being immersed in a diverse culture. What she does appreciate about herself the most, she is proactive, driven, and dedicated to the cause, adventurous and mysterious, patient, kind, and above all, respectful. She is currently one of the junior physicians who volunteered from the onset at the COVID hospital, response to the COVID hospital response team here in St. Lucia. She aspires to be a surgeon. She is driven by the experience in life, whether good or bad. Her enthusiasm and fire are her strongest characteristics, and definitely she depends on them to make a bitter day one full of laughter and smiles. And indeed, she always is smiling. She is goal-oriented and always looks at the future with open eyes and arms. So St. Lucia, I mean, she did Healthwise a few months ago, but let me reintroduce you to our Dr. Joyanne Chico.
A blind soul, she tries to cover up her pain and cut her woes away. 'Cause cover girls don't cry after the face is made. But there's a hope that's waiting for you in the dark. You should know you're beautiful just the way you are. And you don't have to change a thing, the world could change its heart. No scars, see you're beautiful. The stars are we're beautiful. And you don't have to change a thing, the world could change its heart. No scars, see you're beautiful. The stars are we're beautiful. She has dreams to be an envy, so she's starving, you know.
So that's Lucia was our Dr. Joyanne Chico. I was just looking, I thought, equal bell. And then I saw the two clowns in the very end, Dr. Chico and Dr. Giffard. They really are something else. So that's Lucia was indeed our Dr. Joyanne Chico, our nominee for Celebrating Excellence this evening. So with that, St. Lucia, we will take a quick break, and when we come back, we will, allow our frontliners to speak to you of their experience during COVID-19. Back after the break.
Dr. Sharon Belmont George, Chief Medical Officer, Ministry of Health and Wellness. As of April 28, 2020, the World Health Organization reported a total of 2,954,222 confirmed cases of COVID-19 globally, with 202,597 deaths. There are now 1,179,607 confirmed cases in the region of the Americas. On Tuesday, April 28, 2020, results of 44 samples for persons tested for COVID-19 were received. Of that batch, we received 2 positive results and 42 negative. The first of the 2 positive results is a 54-year-old female diabetic who's a direct contact from a previous positive case and has been in isolation from April 4, 2020. She is clinically doing well. The second case is a 20-year-old male who is the son of a previous confirmed case who has also been in isolation from April 4, 2020 and is doing well. It must be noted that both of the new cases are contacts of a confirmed case and have been monitored in quarantine and isolation at the Rodney Bay Public Health Facility from the 4th of April 2020. St. Lucia has now recorded a total of 17 confirmed cases of COVID-19, 15 of whom have recovered and been discharged from care. A total of 490 tests have been carried out to date. We are still implementing our national response to the COVID-19 epidemic, and as such, we should collectively remain focused and committed to reducing the spread of this virus. Some individual measures that need to be sustained include the hygiene measures such as hand washing and respiratory etiquette, the use of homemade face masks, remaining home and away from public places when sick, and to also ensure personal hygiene and to keep homes and office spaces clean. The population most at risk would require special considerations to keep them safe and healthy. This includes ensuring control of chronic conditions, staying at home as much as possible, and facilitating the services to them as needed. The Ministry of Health will continue to remain vigilant and maintain the capacity for early detection, aggressive contact tracing, quarantine and isolation, testing and treatment capacity. We will continue to keep you informed in a timely manner. We have expanded the testing protocols to cover persons with respiratory symptoms within the communities, which will continue into the weekend. The Ministry of Health, we continue active surveillance for COVID-19, but in the interim, we ask all to remain guarded. If you are experiencing flu-like symptoms, go to the nearest respiratory clinic or call one of our telemedicine physicians for guidance. If there is a need for any general information on COVID-19, you may call our 311 information hotline from 7 a.m. to 12 midnight daily. All these telephone services are free to the public. Also, treatment, care, and testing for COVID-19 is free of charge to the public. The Department of Health and Wellness, we will continue to provide the public with regular updates on COVID-19.
Good evening. My name is Dr. Jonah Gifford. I volunteered to be part of the COVID-19 response team at Victoria Hospital, currently known as the Respiratory Hospital. It has been a challenging experience, I must say, and also emotional one. At the beginning, I did not know what I was getting myself into, but I said, why not? It's for the country. I shall go ahead. I still remember my very first night I was on call. I think I was on call the very first day I volunteered. It was nerve-wracking. I went there, obviously, telling myself, of course, Junuma, you can do this. I got there. I donned, meaning I put on my PPE, my protective gear. And at that time, I think St. Lucia had 2 or 3 positive cases at the hospital. Now, with everything that was going on in the world, I wondered, okay, do you have your mask on? If you breathe too hard, are you going to get a virus? Are your gloves on properly? I mean, there were so many things going through my head that night. But I fessed up. I went inside and I saw the patients. As time progressed, it did get better. It became like a daily job. It has become like a daily job. My fear every day is running out of the PPE, running out of mask, running out of gloves, because we're seeing it all over the world right now. The United States is using garbage bags right now. I'm hearing that nurses have to go. They wear the N95 mask and they have to leave it in their lockers at work to reuse it the next day. Right now, we don't have those challenges, but who is to say later down the line we will not be faced with those things? Yes, we're saying that we have no confirmed positive cases on the island right now. But who is to say that we do not have any case lingering out there? So it's a battle. It's a scary one because we do not know what we're facing here in St. Lucia. We know what the rest of the world is facing, and it's a scary thing. It is a terrifying, scary thing. Besides it's not being well and good emotionally, I mean, there is an upside, I guess, to this. Maybe I can call it an upside because we get to stay at Sandals and not go home to our family. The upside is that we're protected. We protect our family, but we miss our families every single day. We do not get to see our families as we want. And if we get to see our families, we can't hug them. We can't give them a kiss on the cheek. We have to maintain 6 feet distance. We have to wear masks. We are not fortunate like everybody else out there that can go home to their families every day, every night, and not be afraid that we're gonna give them the virus. We're not that fortunate. So when we don't do that, we resort to video chatting our family members. So once again, I implore St. Lucians, adhere to the rules, practice hygiene, practice social distancing. This is a battle that we have not won as yet. In all truth, we have not won this battle as yet, and here at Victoria Hospital Respiratory Center, we are facing it every single day. We are working our butts off trying to keep this thing under bay. Just imagine being wrapped in let's say 5 blankets for 4 hours, your nose being blocked with a tissue for 5 hours in this scalding heat St. Lucia has. So you sweat, you become dehydrated in those suits. But then you can't because you have to preserve PPE and you have to see all the patients one time so that you do not waste material. It's a lot that we are going through, I will admit, but somebody has to do it. That's what we signed up for. We took an oath. When we graduated from med school. We took an oath, and we are following that oath. We do hope, however, that this challenge that we're going through, it does get better down the line. We do hope that a vaccine comes to surface sooner or later. But what we can do for now is to help each other, come together as a nation and do what's best. That's the only thing that we can do right now. Help each other, adhere to the rules, and protect ourselves practicing proper hygiene. I will leave you all with one message tonight, and one only. Take care of yourselves. Take care of your families. You do not want to bring home the virus to your 80-something-year-old grandmother or grandfather who has hypertension, diabetes, or who has a respiratory problem. You do not want to not be able to see them at the hospital because they're bedridden, they're sick, they're on a ventilator. You do not want to not know what's happening to your family or not be able to see them because we have restrictions in the hospital where we do not allow family members to visit. So do right by the family, by those that you love. Do right by them. And please, I implore you once more, practice the hygiene and stay safe out there, solutions.
Good night, St. Lucia. My name is Dr. Carrie Lucian, Senior House Officer in the Accident and Emergency Department at the Owen King European Union Hospital. It has been challenging working in the emergency room, particularly at this time with the threat of COVID-19. As staff members, we had to make changes that not only affect us, but our families as well. The management of COVID-19 requires all hands on deck, and as a result, on the 19th of March 2020, everyone on vacation were required to come in and assist, which meant that all vacation had been postponed. When working 8 to 12-hour shifts, we are exposed to numerous persons, and due to the insidious nature of this disease, this puts us and our family members at tremendous risk. Despite employing sanitary measures, along with the use of personal protective equipment, our clothing and shoes are at risk of contamination, and we have to treat it as such. I'm sure we have heard of accounts of healthcare professionals who need to undress outside their homes and bathe before they can even think of interacting with family members. Our staff of the emergency room are no different. We need to take particular care when washing our clothes and sanitizing our bags or whatever else we may take to work, keeping it away from family members. Our success in managing day-to-day emergencies while limiting the risk and spread of the disease is not just up to us staff members. The public plays an important role as well. There are a few things we would like the public to keep in mind. 1. The emergency room is an enclosed space, which can make social distancing challenging, while at the same time that much more necessary. When coming to the hospital, we ask that one person accompanies the patient and that they wait in the designated area outside, leaving space for patients in the waiting room inside. 2. Persons must wear face masks when entering the emergency room. That includes the triage area and the waiting room. 3. All patients visiting the emergency room will be screened at the tent before being allowed inside. 4. In an effort to minimize the spread of COVID-19, the Victoria Hospital is now a respiratory hospital. This means that all patients with any condition that involves a respiratory component, i.e., cough, shortness of breath, and wheeze, will be seen there. This not only includes patients with flu symptoms, but includes asthmatics, patients with a history of COPD, and patients with a history of heart failure who can present with shortness of breath. We would like the public to know that there is an emergency room in the respiratory hospital, which is equipped to deal with patients of all ages, including pregnant patients as well. We ask that the public be honest about their symptoms and to please comply with the guidelines and measures put in place for their and our protection. Until there is a vaccine, this will be the new way to manage and care for patients. We acknowledge that these changes may be uncomfortable for some, but we hope that prioritizing the importance of patients' health and safety outweighs their discomfort. Finally, I'd like to thank all essential service members and the public for their hard work and efforts to get us through this safely. Thank you.
COVID-19 entered our lives and rendered us all powerless. We were all asked to remain home to keep ourselves and our loved ones safe. Unfortunately, that has had many adverse effects on our lives and by extension, our futures. Not only are we impacted psychologically, going stir crazy in one location for an extended period of time, but the mental onslaught has increased our anxiety levels, and to many, it has been depressing. As a dental professional, COVID 19 stopped me dead in my tracks. The dental occupation is at the top of the list, number one for occupational risk. The irony is, when patients come to see me, they cannot wear a mask. I need to see inside their mouths and work inside of their mouths in full view of the possible COVID playground. I was forced to write only prescriptions for persons in pain initially, until acquiring the necessary personal protective equipment to adequately see and treat dental patients. To that, there has been added cost. Personal protective equipment is not cheap. Extra gloves and disposable gowns have to now be worn to safeguard myself and my patients. A restricted number of patients have to be seen as well, as the reception area has to be kept in accordance with the social distancing protocols. The financial strain is being felt, and as such, we continue to encourage persons to adhere to the protocols given by the Ministry of Health in order for us to begin to recover economically and socially as a country. We can fight COVID 19, but we need to do it together.
Good evening, everyone. My name is Dr. Harak Singh, and I am the District Medical Officer for Region 4, and that is the region which covers Deriso, Miku, Monripo, and Tirushe Wellness Centers. COVID-19, or novel coronavirus, as some may know it, it has created tremendous anxiety, we know, throughout the entire world, and that includes here in St. Lucia. The frontline workers, which include myself, we have unfortunately had to make some changes in the way we practice medicine. And I really want our patients to understand that these changes are necessary in order to protect both ourselves and to protect them. For example, anyone who comes to the wellness center, be it for a dressing change or to have a prescription filled, needs to first see the nurse at the front, who then takes a quick travel history or relevant contact history. And if this is fine, then they may proceed to the relevant areas, such as to the triage nurse, the pharmacist, etc. But anyone with any respiratory symptoms, they go directly to the nearest respiratory clinic. We also practice physical distancing, and the patient's chair, which was usually right up against the doctor's desk, is not there anymore. We try to put it a little ways away. I also try to see the older patients first in order for them to be able to leave quickly. Everyone wears a mask, as we have all been doing. The domestic assistants, they also clean the desks, the chairs after every few patients, and they don't wait till the end of the clinic, as was the practice prior to COVID-19. Apart from the wellness centers, I have also worked at the respiratory clinic, and there is some anxiety knowing that, one, you have a greater likelihood of encountering a COVID positive patient there, and two, you will also not be able to keep the appropriate distance of 6 feet when taking the swabs. So it does leave you feeling anxious. But what I do is that I prepare for the process mentally. Putting on the PPE isn't a problem. It's usually okay, but it's taking it off which can pose a greater risk. So I go through all the steps in my head a few times before actually doing the swabs. And in that way, I feel more prepared and less anxious. The last issue that I want to discuss is the fact that there are certain persons who present to the respiratory clinic who change their minds about having the swabs done after finding out about the process. My fellow St. Lucians, please, if there is a reason to have a swab done, if the doctor has asked you to go to the respiratory clinic to have the swab done, please get it done. I have had a swab done myself, and it's not painful. Having a blood test is worse rather than having a nasal swab done. Yes, it's a bit uncomfortable, but it's over in just a few seconds. Oh, by the way, my test was negative. My result was negative. There's really nothing to it. And you may think, oh, even if I have COVID-19, I am young, I will be fine. But please think about your mother, your grandmother, your grandfather, the older persons who are at greater risk and who may have diabetes or hypertension, and they may not be as lucky as you. We need to think of each other at this time, and we need to do what is necessary to keep ourselves and each other safe.
Fernando James, Station Officer Fernando James, EMT Director for the Northern Division of the St. Lucia Fire Service. As you are well aware, the coronavirus, COVID-19 pandemic, has not just stricken the outer parts of this globe, but also the entire region and by extension, St. Lucia. Every single St. Lucian has been affected by it some way or the other, whether it be by illness or even for the economy in terms of the restrictions that have been imposed. But of course, it is for the better good. For the St. Lucia Fire Service, the coronavirus pandemic has, of course, put a lot of pressure on us. As you well know, with our staff constraints and also other resources, we also have to respond to suspected or confirmed cases of the coronavirus. As you're well aware, the Ministry of Health is the lead agency for managing this pandemic crisis in St. Lucia. But the St. Lucia Fire Service is the lead transport agency for providing transportation of all sick individuals who may be confirmed or suspected cases, which will of course be managed by the Ministry of Health officials. This pandemic has caused us to review our patient treatment and patient transportation protocols, inclusive of also our interview or interrogation dispatch protocols and also our personal protective equipment guidelines. One, for the dispatch, when someone calls 911, inclusive of the regular information that will be asked of that patient or caller in terms of location of call and nature of call and what complaints he or she have, there will be additional questions in relation to asking the individual about if they have any history of a fever or cough or breathing problem or shortness of breath or abdominal pain or vomiting or diarrhea of that like. So we'd like the members of the public to be very patient with us during our interview process. The response to emergencies of that nature have caused us to, of course, change our attire in terms of treating patients and transporting them. You will notice that there are additional pieces of resources that we would wear in terms of always wearing masks, gowns and goggles and gloves. And in the event that we have a suspected case, we may be in a full suit. You might think it's like a space suit, but it's not actually not. But it's a personal protective equipment that allows us to be encapsulated in the entire suit to prevent the possibility of any transmission of an infectious disease from the patient to the provider, and also from the provider to the patient. You also know that we are transporting patients to a designated isolation facility for review and, of course, management. So any persons who may have a respiratory problem, despite where they say they may want to go, they all have to go to the Victoria Hospital Isolation Clinic. That's where the specialty nurses and doctors will assess and manage any suspected case. So we've covered the areas of dispatch, transport, and treatment. There are cases whereby if a patient has a breathing problem, we would ask you to, of course, wear a mask. So we'll provide you with a mask and show you the proper application of wearing one. Also, if there's a family member to accompany that patient, he or she will also be required to have one or also be given a mask to wear one if one is not available at the time of interaction with a patient. Once more, I must advocate that members of the public have been adhering to the public health officials' direction in relation to the wearing of commercial reusable face masks. Also, the area of social distancing has been in strong effect, and I must applaud members of the public for trying their very best to distance themselves socially from other persons to limit or to prevent the spread of the disease. At this time, we have had no confirmed deaths. Our total count of patients with who have turned positive are still moderate level, but nothing alarming at this time. But of course, the health officials will give you that toll. I must say that again, we are doing our very best with the limited resources that we have, and we are trying very hard to make sure that the spread of disease is contained and that we provide the best care to the members of the public. Thank you.
small. So now we have them waiting in the corridor. We encourage them not to come too early before their shift. And the chairs outside the corridor are about 5 chairs, and they are 5 feet to 6 feet apart. We check the patient's vitals, their temperature. We ask them if they have any new cough. We check their SpO2 as soon as they come in. Those who have vehicles, we encourage them to wait in the vehicles until it's time for them to come in for dialysis, and we call them when it's their turn. So those are the main things we're doing. New, the hand washing, we usually encourage them to wash their hands as soon as they come in, but we remind them now each time they come to make sure they wash their hands as soon as they come into the unit and to wash their hands on their way out. We have a hand sanitizer dispenser on the way out. So that is something we have always encouraged the patients to do, but we make sure we're reminding them each time they come to dialysis. That's something they need to practice.
As an orderly, my experience with COVID-19, wear masks, wear gloves, and wash hands often.
The housekeeping team worked under tremendous pressure due to the sudden effect of COVID-19. Staff were transitioned into the OKEU and assigned to both the respiratory hospital and the OKEU. Although immediate employment was in effect, some staff were redeployed, schedules were being readjusted, sometimes on a daily basis, due to the inability of some staff obtaining transportation from their place of residence. At first, it was kind of hectic, with us getting used to continuously sanitizing all areas where suspected cases had been seen by the clinical team and ensuring that the fire service was supplied with the required chemicals after transporting our patients. However, despite everything, we have survived as we continue to follow recommended protocol.
COVID-19 has taught me how to always follow protocol and procedure. Make sure we wash our hands, always use sanitizers, and keep our hands away from our face. Wear a mask. It has also taught me how to be patient and how to follow protocol, like standing in line and waiting for your turn so you could be attended to. This reduces the spread, and it has also helped me in my personal development.
I am Sergeant Curtis Roberts, Sergeant in charge of the Scenes of Crime Office and Vice President of the Police Welfare Association. The threat and presence of COVID-19 has created several challenges for the law enforcement officers on our island. For most, if not all of us, it was our very first time experiencing the declaration of a state of emergency emanating from the existence of a pandemic. Naturally, one would have imagined the level of stress, confusion, and panic that existed in the minds of most police officers. Our first order of business would be education. Obviously, being properly educated on the effects, the spread, and the general existence of the virus would assist us in proper selection of personal protective equipment, avoiding exposure, functioning in the midst of suspected cases, and avoiding or minimizing the spread. Functioning in this environment presented several challenges, both for the organization and for the individual officer. Occupationally, law enforcement officers experienced changes in their duties. Some were reassigned away from their normal workstations in an effort to augment staff and perform additional duties. Others, though remaining at their usual workstations, were assigned additional duties. Such duties include and are not limited to ensuring that the curfew is maintained, ensuring that protocols on social distancing are followed, security of quarantine facilities, and the 24-hour manning of the checkpoints between northern and southern zones. The use of additional personal protective equipment became mandatory and has not always been comfortable when used with particular items of uniform and equipment. Public resistance, as expected, was noticed in several cases and created uncomfortable situations for police officers where physical force and restraint became necessary. On the personal side, the fear of the possibility of carrying this virus home to our families was real. Officers had to be sensitized, advised, and in some cases retrained in proper outdoor sanitation procedures. Today, one can feel comforted knowing that to date, no police officer is known to have carried the virus into his or her home. The additional hours of work definitely have had an effect on our family lives and on our health. To date, we continue to play our role as stakeholders in the fight against the spread of COVID-19, along with other frontline workers. I wish to commend all police officers and other frontline workers for their efforts in that regard. I would like to appeal to members of the public to continue to see themselves as stakeholders in the fight against COVID-19. Please continue to heed all national advisories. Remember, we are here to protect you, not to deliberately discomfort or pressure you. Cooperate with our frontline workers, whether the police, fire department, medical, or any other essential services. Let us do this together. Thank you.
St. Lucia, I do hope that you have been inspired or that you have learned something from our frontliners. Again, you'd have heard them urge you to stay home, to cooperate. We can get through this, but we need to do it together. That the changes at the hospitals, the visiting hours are not the same. It's fewer. It'll be more difficult to talk to your family. So FaceTiming, as we are doing with our family members, has to become more of a thing of sorts. But St. Lucia, let's all try to cooperate to get through this. And again, pour dire patois, so St. Lucia, ou tant se docteur, se nos la fireman, police, tout le monde parle au soya, et yo ba ou advice, qui ça imin pour yo, ka travaille COVID, c'est mon nan nou ka qui frontline, c'est essential workers là. Qui ça imin pour yo, qui ça experience yo ye, so pa ba se police la 3K, en border, l'on pas passer, l'on pas dit pour ay faire rien important. Nous savons là, les monde qui kay ni pour cross. Mais si vous parlez pour cross west la caillou, nous pas veux quoi c'est bagay normal, c'est business as usual, tout bagay ok. Nous still veux continuer acte à côté tout le monde ni COVID. Ça pas mean discriminate, mais ça mean is point précaution et mettez masque sur ni pour aller dehors, pas aller dehors si vous pas ni pour faire ça. Make sure ou ka dormir bien, boire de l'eau et ou ka prendre vitamines ou et puis mettre sur ni pour faire ça. Make sure si pressure bien control, si coup bien control, si vous avez docteur, fait ça. So normally ka aller polyclinique là, c'est à deux ces cliniques ça ka ouvert encore, mais même si yo ouvert à l'hôpital là polyclinique là health center, il pas pour manière était avant because tout bagay yon pour mettre distance parmi moun from one moun to the next, so kay attraper là ni less moins moun under ces cliniques là, mais important you know, nous try cooperate because pour nous gagner affaire COVID ça là. So là à l'hôpital là que yo ni pour faire test là bas ou et peut-être quand ni pour rester because si you fait test là ça means you suspect COVID, you peut-être quand ni pour rester, nous besoin cooperate ou pas kay ça ouais famille ou tout là. Visiting hours à l'hôpital là, ou pas ça ouais famille ou le soir et même si là venir le bon matin, c'est moins temps ou ça rester yo et peut-être c'est qu'on ça cahier pour un long temps because COVID kayak nous ne pour apprendre vivre pays et nous juste ne pour faire ces bail là que COVID pas gain nous ne pour gagner because nous ne pour gagner c'est qu'on nous kay survive pour build pays ça là. So tout le monde nous kay espérer encore ou kay cooperate avec nous pour qu'on nous try faire travail nous. So ça cette lycée nous kay finir avec Healthwise soir ou ça ouais épisode ça là encore dimanche après-midi et nous kay invité pour join nous semaine prochaine pour l'autre épisode de Healthwise qu'on nous kay try parler et à deux ces moun qui teni Covid mais yo ha recover et pour yo do qui sa expérience yo toye expérience à l'hôpital là si yo teni symptômes si yo pas teni et qui sa advice yo kay pour cette lycée. So good night et nous kay wow mercredi prochain. Bye bye.